Hello and welcome to the Doctors Roundtable. That's right, we are now bang in the midst of the peak COVID third wave. India has just seen more than 250,000 cases officially recorded in the last 24 hours, and the number could climb. Omicron is very much with us at the moment. But the symptoms, the treatment, indeed COVID care this time will be very different. What are the challenges that we face when we are affected by COVID? I speak about this today as someone who's in the last phase of recovering after a week of suffering from COVID-19. So on the Doctors Roundtable, we're bringing you expert voices to address all the challenges that this new third wave confronts us with. Joining us on the show are special guests. We're joined by Dr. Shashank Joshi, Member COVID Task Force Maharashtra, Dr. Lancelot Pinto, Consultant Pulmonologist and Epidemiologist, Hinduja Hospital in Mumbai, Dr. Khushru Bhajan, he's Consultant Physician and Intensivist at the Department of Medicine and Critical Care at the Hinduja Hospital in Mumbai, Dr. Romel Tikku is Director Internal Medicine at Max Healthcare, and Dr. Chandrakant Laheria is Epidemiologist and Vaccinologist. Thank you all very much for joining us on the show today. Let's get cracking with our first question. And my first question is a very simple question, which maybe Dr. Pinto you want to take, which is the symptoms that one gets with Omicron. How do I know for sure that I've had Omicron over the last 6 days? I tested positive and I had a dry cough for a couple of days, a little bit of fever, and then body ache. Is that classic Omicron symptoms, which in a week later, I seem to be slowly rid of?
Hi, Rajdeep, and thank you for inviting me. And it's good to know that you're feeling a lot better. I think one of the signature symptoms of Delta used to be a loss of smell, or anosmia, as doctors call it. And we aren't seeing much of that this time around. I think that's one of the key differentiating factors between Delta and Omicron. Apart from that, most individuals do seem to present with a lot of body ache. Low backache seems to be a very common symptom. A little bit of nausea on the first couple of days, a little bit of loose motion sometimes for few individuals is what we're typically seeing. So typically day one is just body ache. Day one is a little bit of feeling unwell. Day two and day three tend to be where the fever is 100, 101, 102 sometimes. And day four onwards is where things turn around. So this is kind of the typical picture that we're seeing, very little lower respiratory signs. So even if people do have a cough, it tends to arise from a throat irritation rather than from within the chest, which was also something we saw a lot of in Delta. So predominantly upper respiratory, predominantly body ache, predominantly fever is what we are seeing. And as you rightly pointed out, most individuals do seem to recover very well by day 4, day 5.
So are you saying that after the fifth day, I can start to step out or not very quickly, Dr. Pinto?
So, the US CDC, for example, says that you can come out of isolation with after 5 days, but they also put a caveat saying that this is to be done with strict masking in place for another 5 days. So to answer your question, there is a possibility that you will transmit on day 6 to day 10 as well. The probability is lower. And one of the things that might help you is a rapid antigen test. So rapid antigen test done at home seems to correlate reasonably well with transmissibility. So day 5 or day 6, if your rapid antigen is negative, the probability of you transmitting is quite low.
Okay, let's, Dr. Bhajan, you want to take this. Do symptoms appear faster in Omicron after getting the virus in comparison to Delta? Because we saw it took a week after infection in Alpha. In Omicron, just 3 days after contracting the virus, according to some doctors, the symptoms appear. So is Omicron something where you get the symptoms quickly and you get rid of them equally quickly? Would that be fair to say at the moment?
Yes, Raj. Before I answer that, I must say that I am in awe of you as an anchor, and it's a pleasure to be invited today. Dr. Pinto has answered everything appropriately and perfectly. And yes, these same symptoms occur, but much faster in COVID due to Omicron, and they also go off much faster. So once there is an exposure, you might get the Omicron symptoms within a day or two, and your symptoms like the fever that may occur with both the Omicron or the Delta and Alpha. In Omicron, it goes off in 3 days, whereas in the Delta and the Alpha, it used to stay 10 to 12 days. So yes, the onset is also very quick, and also the symptoms go off very quickly, and the viral shedding is less. The second question you asked us was that the viral shedding is less, and maybe after 5th, 7th day, we do not shed the virus. But as again, Dr. Pinto said, a rat test would help to confirm that. I just will take 10 seconds to in light way to say that we used to have a loss of smell and taste in the previous variants, but I hope we don't lose our sense and our purpose with the Omicron.
Well, I certainly haven't lost my sense of smell, but just to add, you're confirming that if this, even if the symptoms are mild, there is a need to test. One of the questions that is being posed, if the symptoms are mild, is there a need to test? Is there need to have a rapid antigen test at home? Is that good enough according to you, doctor?
No. So basically, the question is, when do you want to test? You want to test to diagnose, or you want to test before you move out of the house of isolation? So once you have the symptoms, you isolate yourself.
Should I test both the time? Should I test to diagnose? Should I test to diagnose? And when I decide to end isolation, should I be testing at both ends of the spectrum?
Yeah, so testing is needed to diagnose definitely, and that would help, not because you may not have the symptoms, but your family and your other very close high-risk contacts might have. So it's always good to test to diagnose. And once you are better, which would be in 4 or 5 days, unless you have comorbidities, and if you are above 60, 65, then only would on the 5th or 7th day before you move out, you probably want to do a rat test. This applies a little more towards the healthcare professionals like us who need to join back to work. And in that case, a rat test is absolutely necessary to make sure that we are not giving it to the others. But having said that, because of the overwhelming nature of the Omicron, I think we might even do away with this rat test after the isolation period is over very soon.
Okay, interesting that you're saying that. Dr. Joshi, you're in the Maharashtra COVID task force at the heart of it. One of the questions that is being posed is interesting because do asymptomatic patients spread Omicron? There's been this huge debate whether asymptomatic patients should, in this particular instance, observe the same protocol as symptomatic patients. What's your sense? Do asymptomatic patients, Dr. Joshi, spread Omicron?
Absolutely. In fact, they are the invisible carriers and they definitely spread Omicron. So there is no question asked. Only thing is, for asymptomatic people, the rules have been tweaked because after 7 days, if they are completely asymptomatic, then with double masking, they can go back to work. That is all what has been said, particularly in people who are on front line, who are in healthcare profession, or who are on daily wages. So in them, their livelihoods are affected, or the care of delivery of healthcare or frontline is affected, which is why. But they are still contagious. See, normally the
but then how do I know I'm asymptomatic? Sorry, doctor. Doctor, how do I know I'm asymptomatic if I don't I don't have any symptoms, but I'm asymptomatic with Omicron? How do I know that?
So that is where the currently the surveillance testing was going on, and people were doing contact tracing. But the point is, the burden of the disease is so large. And if your immune system has reacted and you have not caused any symptoms, most of the time we feel that your own body's immune system will take care of the virus. And which is why many of the countries across the world where healthcare systems are likely to be overburdened by the explosive nature have dropped that there is no need to test asymptomatic people. But COVID appropriate behavior, whenever they are in public places or crowded places, closed spaces, poorly ventilated environment, is expected and anticipated. So this is given on the premise that people will cooperate and double mask whenever they are with other people around outside a bio bubble.
Dr. Joshi, linked to that is a question that is being asked. Is Omicron just a cough and cold for most people? That's Dr. Joshi. Should it be treated just like cough and cold?
So I think we should not be so dismissal about this mild nature of the virus. in most of the people, most of the time who are not in the vulnerable group, it is likely to be having a mild disease which will recover like a flu-like syndrome, which only needs symptomatic treatment, and paracetamol and probably inhaled budesonide may be the only drug if required if there is persistent fever or persistent cough. But in the high-risk category, people who don't have an immune response, they're immunocompromised, they have comorbidities, they are vulnerable groups, in them it could still lead to moderate or severe disease in small group of cases. So compared to Delta or the ancestral variant, the likelihood of deterioration of Omicron is lesser even in these vulnerable groups or even in the vaccinated groups. The only feature of Omicron is it is having immune escape. So the challenge is that even if people had COVID in the past with the old variant and or have taken 2 vaccines, it will still occur. But the disease is predominantly mild, and that is a very reassuring thing.
Let me ask you this, Dr. Tikku, because it's a question that my wife wants to know. She says, my husband, that's me, has had COVID. Should I have isolated also during this period? Because now I also have a bit of a sore throat. Should I be immediately testing? Is it important that family members of anyone who's got COVID, who's isolating at home, should they also isolate, Dr. Tikku?
See, if they have symptoms, they also need to be isolated or in quarantine till their test comes out to be positive. And if it's positive, they have to be dealt with the way you deal with a positive case. But if they don't have symptoms, our guidelines now say that if they don't have comorbidities, if they're not elderly, we don't have to test them. But I would still advise them to be in quarantine because in the next 3, 4, 5 days, they might develop symptoms. So contacts of positive patients could become positive in the next few days.
But my wife has tested negative. Sir, my wife has tested negative in the home
test. It all depends on when you are testing.
She does not have COVID.
Yeah. No, it all depends on when you are testing. If you are testing on day 1, when she's exposed to you, maybe she is negative, but in a few days, maybe 2, 3 days down the line, she might become positive. And if she is up and about, well, she might be infecting more and more people that once she gets positive. So the guidelines say that you have to be in quarantine for at least 5 to 7 days. And during those days, if you have symptoms, then you get tested. If you don't have symptoms, after 7 days, you can come out of quarantine. Right. It's advisable to stay inside and be isolated.
Okay, those are questions that lots of people are asking. Dr. Leheria, the key question that I think many want to know is: are we seeing the peak already of the third wave? 250,000 cases added in the last 24 hours, or are we likely to see more peaks? Could it go up to 4, 5 lakhs a day? Is it going to get worse before it gets better, Dr. Leheria?
So what we know that currently the surge is being seen in major city, large city or metropolitan cities, and we have still not started seeing the major rise in the medium and smaller towns. So what we are seeing, and various projections indicate that while we know that Omicron surge happened in a quick period, like 2 to 3 weeks, it peaks and then quickly declines. So what we might see in the current wave, that while the major cities might see a decline, but by then major cities start seeing decline, the medium town and smaller towns start seeing increase in the cases, and then the rural India. So in the current wave, it is very much possible that in the quick succession, there will be 2 to 3 waves, a short wave. So we might not see an increase or very high peak in one go, but we might have a sustained high number of cases for a period of, say, let's say 3 to 4 coming weeks. So I would say we might not see a big peak, but a sustained peak. And then by end of February, we might see a decline across the country.
End of February, you might see a decline, but the next 3 or 4 weeks, you may see various peaks. Okay, let's come back to critical questions that are being asked by patients. Dr. Pinto, a number of people are testing at home at the moment. How reliable are these home testing kits? Can we go by them and bank on them, or should I be taking an RT-PCR if I have symptoms? I tested positive on a home testing kit, for example.
So home rapid antigen tests tend to have a very high specificity but a low sensitivity. So what this essentially means is that if 100 individuals with COVID actually test on a home antigen kit, about 50 of them probably will be missed. So a negative home antigen test does not mean you don't have the disease. But a positive test has a very high specificity, which means that it is very unlikely that you don't have COVID if the test is positive. So a positive test kind of ends the story in terms of diagnosis. You have a diagnosis in front of you. But if you have a negative test and you have symptoms which are compatible, an RT-PCR has a higher sensitivity, and that would be the test of choice.
Okay. Dr. Bajan, a number of patients are getting COVID when they go to hospitals for other surgeries, for non-COVID surgeries. Should planned surgeries be postponed? Is that something you would advise? If the surgery is not an emergency surgery, is this the right time to be going through one, Dr. Bajan?
Yeah, that's a very, excuse me, that's a very relevant question. And I completely agree that when we have a surge and we have a peak happening with the third wave, we need to cut down on all elective work. So elective surgeries, except for emergencies like strokes, myocardial infarctions, acute abdomen, surgical emergencies, even in India, the tropical ones like dengue, malaria, who are severely ill, these should be admitted, but otherwise all elective work should come to a standstill. Also, the other group of patients who are oncology patients and dialysis patients, their work should go on. This is a little bit of a misconception that patients come with a negative test. We see this all the time, and they come to the hospital and they become positive. As already mentioned by the panelists, they may have done the test when they had no symptoms, and then now they still may fall into the asymptomatic category because they are not high risk and they have developed a positive test in the hospital, just done again before the surgery or whatsoever. So therefore, I think now, because the spread is so heavy, we are going to see each and every candidate in India, across the world, getting affected by Omicron. So getting a test positive in A, B or C place does not attribute that they got it from A or B or C. It can happen anywhere.
Okay. Interesting, the fact that, if you can put off your surgery, this is a good time to put it off. So don't take the risk necessarily of hospitalization at this stage. In any case, with Omicron, hospitalizations are much less, Dr. Joshi. Is that, do you believe, a trend that will sustain itself? You're looking at Mumbai, for example, and as part of the COVID task force, is there a sense of confidence that hospitalization will remain low? Because we are seeing in the United States, hospitalizations are surging. We don't know whether it's only Omicron that's doing it or a mix of Omicron and Delta. But in India, hospitalization under control. Do you believe that will remain the case for the next few weeks?
Rajdeep ji, I think you're very right. In US, the picture is unvaccinated population, a little bit of Delta and Omicron. In India, we will be on Omicron world. Clearly, the number of hospitalizations, need for oxygen, need for ventilator or ICU care is much, much less. But we still have Delta around, and we should not miss that occasional Delta. See, Omicron predominantly is the throat virus and predominantly affects the throat, nose, and the body in general, but does not affect the lower airways or the lungs. And there is very good data to support that. While Delta still affects the lungs. So if you have a lung involvement, you will still need hospitalization. Across India, it is a very heterogeneous mix. So you will see predominantly Omicron, but a little bit of Delta. In the hospitals, we are clearly seeing much lower numbers. The need for oxygen in Mumbai, for example, if we compare second and the third wave, head to head is far less. It's almost 90% less than what we needed at a peak in April, for example, and compared to now where we are at the peak probably. So it's very clear that the Omicron related illness definitely has a much lower hospitalization, need for oxygen, ventilator or critical care. But people who are vulnerable, people who have underlying diseases, severe immunocompromised states will probably still deteriorate and they need care and we cannot ignore or dismiss them. The challenge is the numbers in US are explosive.
No, so are you saying?
The numbers in US are far explosive.
Are you saying only those with comorbidities? Are you saying, doctor, only those with comorbidities or those whose oxygen level may fall sharply are advised hospitalization, that otherwise home isolation is good enough?
That's correct. That's absolutely correct. That people who are not below 50 years or 60 years and do not have underlying comorbidities, they definitely will recover. Most people will recover at home only. But they need expert supervision. We still need to monitor oxygen saturation and we still have that occasional Delta around. But US, probably the numbers are so explosive. That is why their healthcare infrastructure is getting strained. And in India also, if the numbers explode and we have a test positivity rate of almost 50%, then again the healthcare system can get overburdened. But it's unlikely to happen because actually right now, if you see, we are already seeing a little bit of plateauing or flattening effect in Mumbai coming up. And if we are following the South African pattern, it is likely that we will be out of this maybe by mid-February, at least in Mumbai city.
That's reassuring, at least for Mumbaikars. What are the new markers for hospitalization, Dr. Tikku? When are you, because a lot of people are asking about this. As I said, those who got elective surgeries, it's being suggested postpone them. Are there any new markers when you are telling someone to hospitalize? Is it again low oxygen levels or comorbidities, as I suggested earlier?
Yeah. Well, if it's progressive, the disease, and it goes to the lungs, which is not happening with most of the Omicron patients, then we advise admission. If they're having chest pain, if they're having breathlessness, if their saturations are dipping to less than 94%, or if they're a very high risk, comorbidities, diabetes, hypertension, heart failure, then we advise admission. But having said that, majority of the patients who are getting admitted with COVID right now are the ones who have comorbidities and the ones who have severe disease in the ICU. Almost all of them are, most of them are not vaccinated, or they are diabetics, or they have some sort of comorbidity, or they are elderly. So if we look at the statistics, even globally or even otherwise, most of the patients who are young without comorbidities, they are not needing hospitalization at all. The ones who are getting hospitalized or are having moderate to severe disease are the ones who are not vaccinated and have comorbidities. So that's why the hospitalization rates are much lesser this time.
So very clearly, if you're unvaccinated or partly vaccinated, that is a real fear. We'll come to vaccines in a moment, but to look at treatment for now, Dr. Pinto, is paracetamol the only basic treatment for someone who's home isolating? I can tell you what I did. I had vitamins, Becosules in the morning. I had vitamins, cetirizine in the evening. During the day, I was taking certain tablets for my cough. Is paracetamol the only treatment, or a Dolo? Is that enough over 5-6 days?
I think for a majority of individuals, that would be absolutely right and fair. You would need what we call symptom-based treatment. So if you have nasal congestion, a bit of an antihistaminic, a decongestant would probably be the right drug of choice. For fever, for body ache, it's predominantly paracetamol. Some individuals need something that's a little stronger, like ibuprofen. Some individuals have been complaining of a lot of pain, which does not go away despite paracetamol. The antiviral drugs that are currently available in India are molnupiravir and remdesivir, and I would use them in a very tiny fraction of individuals. Individuals who may be unvaccinated and are high risk. So somebody who has multiple comorbidities, who is high risk of deterioration. In that small fraction, I would consider intravenous remdesivir for 3 days in the first week, or tablets of molnupiravir for the first 5 days. Of course, we know that a lot of red flags have been raised around molnupiravir, so you would definitely not use it indiscriminately. But again, as you rightly pointed out, for a majority of individuals, which I would say would be close to 95% of individuals, symptom-based treatment with paracetamol being the lead runner would pretty much sort out most of the problems.
You mentioned twice molnupiravir, Dr. Pinto, and I want to ask you this because ICMR and various doctors seem to be at loggerheads over use of molnupiravir. Should it be used or not? Is it not safe? It's been approved by for emergency use. So should I, if my physician advises it, go ahead or not?
So if you look at the drug trial, which actually proved the utility of molnupiravir, it was used only in unvaccinated individuals. So that's number one. Number two, even in that trial, it showed about a 30% risk reduction in the risk of progression of disease, right? So that's not a huge number in unvaccinated individuals. So whether in vaccinated individuals it really provides any extra juice is highly debatable. Now, in children under 18, there are concerns related to cartilage growth being affected. In individuals on the whole, there are some concerns related to it being potentially promoting cancer. So that's a cause for concern. In pregnant women and in individuals who are potentially of the childbearing age group, there are fetal abnormalities which have been marked as a red flag. So definitely not a drug to be used across the board, but in a small subsection. So supposing you have an immunocompromised individual, for example, in whom vaccine efficacy is a little under question, have they really, mounted an antibody response to the vaccines? In somebody who's elderly with multiple comorbidities, I wouldn't, of course, discussing it with the patient, explaining to them all these above caveats, I would consider it in a very tiny fraction of individuals, but definitely not to be used across the board.
Okay, something else which has also been debated is antibody cocktails. Are they ineffective or effective, Dr. Bhajan, against Omicron? Are you recommending it to any of your patients?
Yeah, so that's again an important question. We have had monoclonal antibodies being given to hundreds and thousands of patients by all of us, but that was during the Delta wave. And we have enough evidence now that it does not work against the Omicron. The good part is it doesn't stop there. So there is, just as the virus evolves, our medications and our science evolves. And we have had the newer drug that is a synthetic monoclonal antibody called the Sotrovimab, which is US FDA approved for patients who are mild and moderate Omicron, and it definitely works on that. Also, the other drug which just got recognized by the WHO for critical and severe cases is the age-old rheumatoid arthritis drug that is baricitinib along with the steroids. So now we have definitely more and more medications in our armamentarium along with the home care molnupiravir, as Dr. Lance beautifully explained.
Pallavi is asking, Dr. Tikku, are there any home remedies to fight Omicron? Should we look at home remedies at all?
Well, not really. Well, you can do the gargle steam, you can have your Kada and things like that. They do give you some symptomatic relief, but I don't think it would really help in fighting the virus. Well, it's self-limiting. No matter what you do, it's going to take its own sweet time. So paracetamol, good hydration, listening to your doctors, staying in isolation is what I would advise, but no harm. You can try all that, and it might just give you some sort of symptomatic relief, but go with medical advice, I would say.
Okay, let's look at vaccines for a moment. Dr. Laharia, it appears as of now, mainly those who are getting hospitalized are unvaccinated or single vaccinated with comorbidities. Vaccines, are double vaccinated people also at risk is a question being asked. If I'm double vaccinated, I was double vaccinated, I've got Omicron. Am I less at risk, clearly, than someone who's even single vaccinated? Is double vaccination an insurance?
So what we need to remember that vaccines prevent from severe disease, hospitalization and death. So vaccines do not prevent from infection. And that is a major confusion which people are facing, that people are saying they are vaccinated, but they still got infection. So let's be clear that vaccines do not prevent from infection, at least the vaccines which are being used in India, but they continue to prevent from severe disease, hospitalization, death. And for that, 2 shots of vaccines are enough. And that's what is happening. We are seeing a decoupling of infection from disease or hospitalization just because of people are vaccinated. So vaccines continue to protect, and 2 shots of vaccines for every adult continue to protect. Of course, the risk of infection is there, and even amongst vaccinated, a small fraction of people can get moderate to severe disease. But most likely, those individuals are the ones who have a coexisting morbidities or pre-existing morbidities, or the individual who are 60 plus or other health condition. But to summarize, vaccines continue to protect. 2 shots are enough. And along with that, if you are eligible for precaution shot, being a health worker, frontline worker, or 60 plus with comorbidity, please get a precaution shot that will provide additional layer of protection. But to prevent infection, please follow COVID-appropriate behavior and especially mask.
I'm coming back to, let's come to those precaution doses in a moment, because Dr. Joshi, many are asking, why is the mixing of vaccine not being allowed? You've been part of various discussions on this. If I've taken Covishield, double vaccinated, my booster, I'm over 60, I have to take it only Covishield. Should I not have had the option? And this is again linked, why are Covovax and Corbevax not available as vaccine options? Everyone is saying that these are perhaps, the ideal booster is a Covovax booster, but it's not available. A, do you believe mixing is a good thing? Or are you okay with the present system?
So let us look at the science of this, Rajdeep. Science of the current data globally published shows that mix and match strategy is a heterologous boosting is a much better strategy. As far as India is concerned, we have not generated any Indian science on this. It is oncoming or ongoing science. So there is a brevity of data from the Indian part on the mix and match part of it, which is why currently, because it's a very centralized process, none of us have any role in the decision-making process of the vaccination policy. It is completely centralized, and therefore they have decided to give after 9 months a precautionary dose. They are not even calling it as a booster dose to healthcare workers or frontline workers, etc. Yes. Clearly, we need to generate good quality science in the so-called heterologous boosting strategy and definitely use much more vaccines. But it will depend on the availability of the other vaccines. For example, we had Moderna approved, which was supposed to come to India, which has never come. We had a Janssen vaccine approved in India, which was supposed to get produced in September. It has never come. We have Covovax and Corbevax, which have been approved by the DCGI, but they are still not in the market. Sputnik was there, but it hardly got used.
No, why? Dr. Joshi, why is Covovax not in the market? You know, Serum Institute is manufacturing it, exporting it to other countries, but Indians can't have access to it.
I completely agree with you. I mean, this is a question which I would also ask to the people who are there. And I think these are all related to the availability of the vaccines. So currently what they have done is they have collated the best available evidence and tried to give the best available option to the people which are available, which is the same dose, because it's a little delayed dose. Also, a lot of the science is based on the presumption people have hybrid immunity, which means there has been a large exposure. And also we have seen that most people now in the Omicron wave also will get exposed, and there will be an immune escape phenomenon. So obviously there are multiple challenges in this, but clearly this is one unmet need where Indian science needs to be generated quick and fast, because then it will give us answers to your question, Rajdeep.
Yes. Okay, then, linked to this, D. Chakrabarti asked Dr. Pinto, what is the logic of the 9-month gap for booster dose? He says, the threat is now, my parents are 82 and 76 years. They got Covaxin at 1 month gap and are now being denied booster because it is 6 months since their second shot. At their age, they need a booster now. Do you agree that the gap needs to come back from 9 months, maybe to 6 months?
I think some of it is just, my guess is that it would be supply related. The fact that if you put 6 months as the gap, you would have a huge number of individuals who would be eligible. If you look at the 9-month gap, I think, if I remember right, March last year was when vaccination was opened to those who were elderly. So those individuals you would consider to be the most vulnerable right now. And those individuals who've received their vaccines around March would therefore now qualify for the booster, along with the frontline workers who also received at the same time. So I would, in an ideal world, I guess if there were no supply constraints, it would be fair to open up the boosters to anybody 6 months down the road, especially knowing that this is a variant that breaks through whatever immunity has been offered through earlier vaccines, and a lot of other countries in the world have done it at shorter intervals. But I guess that would be contingent to supply, and if there is enough supply, yes, I think it would be a good idea to shorten the gap.
But what's your sense? How long will the booster immunity, Dr. Pinto, last?
So I think that's a question which nobody really knows the answer to. I think the fact that a lot of individuals will this time round get infected with the Omicron, just the velocity at which it's spreading right now, will hopefully act as another hybrid immunity in terms of, so we now have a population, a significant proportion of which got infected the first and the second time round, Alpha and Delta. We now have a population which will also get infected with Omicron, or a large quantum of the population will. And then you have vaccines to add to it. So hopefully this kind of an immunity will again protect us significantly from moderate to severe disease. Maybe infections will happen. Maybe we will need periodic boosters to kind of protect the vulnerable in society. But hopefully a majority of us will have some sort of immunity from moderate to severe disease, which is, as Dr. Laharia pointed out, that's exactly what vaccines are designed for.
Okay. I just want to come again to treatment, Dr. Bajan, because another question has come in. Should patients follow a particular diet during Omicron? Should I follow a light diet or a high protein diet? What's ideal, Dr. Bajan?
Yeah. Rajdeep, can I just add a little to the previous discussion on vaccines for a bit?
Sure. Please.
Yeah,
Please.
so there is a very nice study which came out of UK in December, early December, which said that if you take one dose of vaccine, the hospitalization is dropped by 52%. If you take two doses, then up to 6 months, the hospitalization is reduced to 72%. But if you have taken two doses and if it's beyond 6 months, then it again drops back to 52%. And in that same study, they showed that the booster within 2 weeks would reduce the hospitalization to 88%. So it's a time game, it's a time frame, and we need more and more vaccines, and we need vaccines which cover more and more variants. So just wanted to highlight that one study which is pretty useful. Coming to the management, yes, of course, as doctors, we always say, and Shashank would agree with me, for diabetic control, it's exercise, lifestyle, diet, and the medication. So we've discussed medications as a whole. Diet, I don't think having suddenly a high protein diet or a better carb diet or something like that during the COVID pandemic would change the picture. It's only when you are in good time that you should build up your immunity, and you must improve your diet, your lifestyle. You might even do some pranayams and many other yoga stuff, even Surya Namaskars to build up your immunity. But there is no one particular magic diet which is going to help you to fight the infection.
Right. In fact, Dr. Joshi, someone is asking, are there any superfoods to boost immunity? Dr. Joshi, any superfoods?
See, there are a lot of these available on Dr. WhatsApp and Dr. Google. Please don't get carried away by them. Eat on time, eat appropriate food, have a portion control, have adequate liquids, warm water, sleep for a good 8 hours, and eat slowly. Don't eat very fast. These are simple things which we can do. Yes, there are many natural foods which are available, including fruits and vegetables, which have very good antioxidants. So I think you just should continue your normal diet. We should not have excess of carbs, excess of fats. Don't have fried and fast food. Don't try to order foods. Try to have simple home cooked foods which your ancestors used to have. That's all you need to do during COVID times. Maybe a little bit of extra protein definitely helps. And that's all you need to do. So there is no rocket science in this. But the only challenge is currently we are wedded to a lot of fast foods and fried foods, which actually can be deleterious for the immune response. They can have trans fat, and they can trigger cardiometabolic conditions. And all the deaths which occur due to COVID is all because of cardiometabolic underlying abnormalities like diabetes, blood pressure, heart disease, kidney disease. And they definitely need some amount of eating less, eating slowly, eating on time, having a large breakfast, moderate lunch, light dinner, and being, just using simple common sense and grandma's remedies. That's all you need to do.
You're raising something very important, because there are two other questions that are coming in. One is, Dr. Tikku, is there enough information available now on long COVID due to Omicron? We saw with Delta, people had long COVID illnesses that came up 6 weeks, 8 weeks after the infection. Is the fear there that with Omicron also this could happen, even though the symptoms are mild today, tomorrow it could affect me? Can I go tomorrow itself, if it's 7 days since I had Omicron, can I hit the treadmill on day 8 or not? Or would you advise a gradual entry into physical activity?
Well, I would advise gradually get into it and take rest for the next 2 weeks at least. With Omicron, we don't know about the long COVID. It's too early to comment on that. We've just been about 1 month into the disease. Time will only tell. But my guess is that some of them might actually end up with having long COVID. But again, we need data on that. In the coming few months, we'll know more about that. But by and large, because the disease is mild and because the inflammatory markers are not that high, because the severe disease is not that much with Omicron, probably we might not see the kind of long COVID symptoms we saw with Delta patients. But you never know. Only time has to tell us more about that. But as of now, we should try to stay indoors and take all the precautions and take care of our immunity, as we discussed about the diet, exercise, and avoid smoking, avoid alcohol, avoid eating outside. I mean, all that has to be taken into consideration. But if you talk about long COVID, I would say that we still need more data on that, and the coming few months will only tell us more about it.
Dr. Pinto, you want to get in on that, because we discussed long COVID during Delta. Is there any concern over that with Omicron as well?
I think we don't completely understand long COVID to begin with. I mean, there are various theories about viral fragments staying in the body for some time and them causing some sort of an immune response. So I don't think, even from the earlier waves, we know that the severity of the disease has not always correlated with the length of long COVID. So some people with mild disease, unfortunately, do tend to have long COVID. We're seeing a lot of fatigue with Omicron. It seems to be a very prominent symptom, even 10 days, 2 weeks into post-illness. A lot of individuals are complaining of fatigue. Hopefully, most of them will recover, but it's something that we need to watch in terms of pathophysiology, because there's no
So do I
fundamental
get back to a full
strongly
day's?
believe.
Do I get back to a full day's work next week? Do I get back to a full day's work as a result next week, or do I do it gradually?
I mean, I would advise to take it lightly, simply because, a lot of my patients have told me that they've tried to go back with a bang and then they've been knocked out for a couple of days after that. So, my general advice to most patients has been to gradually get back to life, rather than, wake up in the morning, feel absolutely great, push themselves really hard, and then regret it for the next couple of days.
Okay. Interesting question, which a lot of people are asking, Dr. Laharia. Does an Omicron infection give immunity against Delta? The fact that I've got Omicron, can I believe now I've got the antibodies, I've got the immunity, that this is the natural vaccine theory?
So in any case, in India, with the 2/3 of the population already developing antibody after second wave, and then 90% of adults receiving at least one shot and 70% with both shots. So people have some immunity. But to answer your question about Omicron and after that immunity, there is a study from South Africa which found that people who develop Omicron infection, and if they had a past infection or vaccine, they have a 14-fold higher amount of antibody. And that antibody which is developed after Omicron actually prevents from the future Delta infection. So it is a good news indeed for the people. And in a sense, that's why the entire world is talking about that world has some infection due to natural causes, natural virus, then vaccines have been administered to a large proportion of population. And with the Omicron infection happening, which is mild and which is widespread, so the people would be developing antibody which will prevent for future infection. And that is a good sign, and what is being discussed, that because of this Omicron widespread infection, we might enter into a phase which can result in endemicity. So it's not all the bad news, some good news in Omicron infection.
Linked to that, Dr. Laharia, should children below 15 take vaccine once they are available? Are you very clear that all children should be taking this vaccine?
So what is very clear that younger than 15 children may not need vaccine, except for within the 12 to 15 years children who are high risk. High risk means they have either pre-existing morbidity or immunocompromised or on long-term treatment. So such children might require COVID-19 vaccine in the time ahead. But as of now, only 15 year and older are recommended. But there is another dimension. We now know that this Omicron infection is happening, and this is happening at the really fast pace. It's essentially adults are getting infection and children are also getting infection with Omicron. But we know that the infection in the children in current wave is even milder than the previous waves, and children recover quicker than the adults also. So with this wave happening, children are again getting exposed and then developing antibody. So in the months ahead, neither the children might require vaccines immediately or even for adults who are getting exposed along with the vaccines. So the booster dose for the remaining adults who are not currently recommended booster may also require a fresh consideration, because with this infection, adult would develop antibody. We actually can defer the booster for adult for some more time.
Let me ask that too. Let me ask that therefore to you, Dr. Joshi, in conclusion. Do you believe that we are in a better place today than we were 6 months ago? Are you completely confident? There are those who are saying that we in the media are putting out this Omicron alarm. We are being too alarmist because of what happened in the second wave. This time, rather than press the panic button, we should be much more relaxed about it. What will you tell those who are saying, let's not get alarmist about Omicron. Let's treat this phase of the virus with a sense of calmness. What will you tell them?
So Rajiv, there are two vertically divided groups. One group which believe that this is a mild flu-like syndrome and nothing more than that. And there's another extremist group which says that yes, you can get serious disease also. I think we need to have a golden middle path with caution. Look at what is happening in the US and Europe. They are exploding with sheer numbers. They still have Delta around, and they have a large bout of unvaccinated population. So I think two, three things. Number one, there is no cause for major alarm, but we can't allow numbers to grow rapidly and quickly. So I think before they overwhelm the system. Number two, I think we have to vaccinate people who are totally unvaccinated. We still have a large population, including senior citizens, who are not vaccinated even with a single dose. And I think that is something which we need to take on priority.
Right.
Complete our second dose in place. Extra doses, whether they work or not, whether children need a vaccine or not, these are unanswered questions. And rather than being speculative or panicky, we should be cautious and careful. I think the strongest vaccine we have is a simple, properly fitting N95 mask or a 3-ply surgical mask, and ensuring that we don't clutter in closed spaces or crowds. If we behave appropriately and behave sensibly, and that's all we need. I don't think there is need to cause that big alarm button, because you see this current strain of the virus appears to be milder for sure, but we should not miss that occasional delta. We should have a zero COVID death policy and least number of severe cases. Every life is precious, so we need to save every life. And we hope that in this wave, we will be able to save as many lives as we can.
Okay, I've just got 30 seconds. I want to ask you, Dr. Pinto, a final question. Now that I've completed a week of home isolation tomorrow, can I have a glass of toddy in the cold of Delhi? Can I have that or not recommended?
I don't think I would want to deprive you of the simple pleasures in life, Rajdeep. So if you've recovered, I think everything in moderation is, especially, if it's been 7 days, you've had a mild course. I think it warrants a mini celebration, if not more.
Okay, I'll leave it at a mini celebration for now. But it's been a week of learning for me as well, this period of home isolation. And all that I've heard in the last 1 hour has also, I think, enhanced my wisdom as that of the audience. So I thank again my doctors for sharing their wisdom with us. All I can say to all of you out there, stay well, stay safe, stay masked, stay vaccinated. Thanks for watching. Bye for now.